Hello everyone, I am Surbhi Sharma. I am Assistant Professor from Ramesh Institute of Vocational and Technical Education, Greater Noida. Today in this video, we are going to learn about parenteral products. This topic is from Industrial Pharmacy BP 502T, Unit 4th, that is parenteral products. Today in this video, we are going to learn about introduction. What is about parenteral products? Before moving on to the topic, we should know what parenteral means. Parenteral basically means when we are dissociating the word parenteral, we are dissociating para and enteron. Para means outside and enteron means intestine. Means when we are taking any tablet, that tablet is getting inside our body. It is getting dissociated, it is getting disintegrated, and then it is moving to the stomach, then intestine, and excreted out from the body. Okay. So, this parenteral product, these parenteral preparations are those sterile preparations that are intended to be used outside the intestine, means they are getting absorbed outside the particular intestine. That is why it is called as parenteral. Okay. So, how can we define it? Parenteral products are the sterile preparation intended to be administered directly into the systemic circulation, means these are the sterile preparation that we are intending, means they are free from pyrogen and they are getting intended to be administered inside the body. Okay. So, there are lots and lots of IV routes, there are different routes of administration, we are going to learn it later on in previous slides. Okay. What is the advantages of parenteral products? There are lots and lots of advantages. As I told you, parenteral products are those products that are intended to be administered in systemic circulation, means inside the bloodstream. Okay. So, there are lots of advantages we can see in this particular slides. Moving on to the first advantage, the IV route is the fastest methods for delivering systemic drugs. IV route is the fastest route. Why it is called as fastest route? Means the drug that we are administering through the parenteral routes, they are directly into the systemic circulations. I told you right now that when we are taking the tablet, that tablet is getting inside the body and it's taking a prolonged time for getting absorbed. But when we are directly administering drug inside the systemic circulation, it is getting fastest absorption. That's why it is called as fastest methods for delivering system of drugs. Okay. Preferred administration in emergency situation. Second point is this parenteral route is most evident for administered in the emergency situation. Like for an example, we are in hospital and there are lots and lots of emergency situation taking place. Like for example, the doctor need to give anesthesia to the patient. For that situation, we need to give through IV route. Why? Because it is very much rapid. As I told you in the first point, it is a fast method and that is why it is used in emergency situation. Okay, that is why parenteral products are majorly used. After that, it provides fluids, electrolytes and nutrition. We can incorporate fluids, nutrition, electrolytes inside the systemic circulation. Okay. After a patient who cannot take food and has serious problems, in the GIT tract are having issue. Like for an example, there are lots of patients that have mouth cancer, they are having lots of problems, they are not able to swell, like for example, very small kids, they are not able to swell properly. Okay. So, for them we can administer through parenteral routes. Okay, this is what this point says. It provides high concentration of drugs in the bloodstream or tissues. Obviously, as we are directly incorporating our drug inside the bloodstream, so they need to be directly incorporated on the bloodstream so that it can be used for further to the patient. IV infusion provides a continuous amount of needed medication. Infusion rate can be adjusted. Obviously, infusion rate can be majorly adjusted. You have seen in the hospitals there are drips that is being placed in the hospitals. We can adjust the particular speed of the drip. How? By the means of infusion rate we can adjust. And as this product is being directly administered into the bloodstream, they should be sterile and free from pyrogen, means they are free from disease causing ailments. We will learn about it further. Okay. Everything that has advantage also has a disadvantage also. So, we are going to enlist some sort of disadvantages. Number one disadvantages is basically traumatic injury from the insertion of needle. You have seen that there are some conditions when needle is incorporated inside body. Okay. For some patients that needle can be injurious. Traumatic injuries can happen because of some oil based preparations. Okay. Impossible to retrieve if adverse reaction occurs. As I told you, these preparations are directly administered inside the systemic circulation, means inside the bloodstream. So, they need to be adverse it is very much impossible to retrieve the adverse drug reaction. Means if a drug reaction is having some adverse effect, okay, it is impossible to retrieve. Means उस चीज़ को हम दोबारा से retrieve नहीं कर सकते, उस चीज़ को दोबारा से back off नहीं कर सकते. अगर we have administered anything inside bloodstream, we cannot revert that. This is the biggest disadvantage. Injected directly into the body. As we all know, it is directly injecting inside the body. Okay. Correct syringe, needle and technique should be used. Obviously, correct needle and technician should be used. Particular angle, particular needle, how we are incorporating it, how we are administering it, how we are treating the patient, all these things need to be done by a proper doctor or a technician or the particular nurses that are very much expertised in this. Okay. It is also difficult to say if the patient is overdosed. Here it is written, if the patient is overdosed, it cannot be revert back. As I told you in the second point, adverse drug reaction occurs, it cannot be revert also if the overdose occurs. We can only give antidote or we can just cure it, but we cannot revert it. For an example, if we are taking oral tablets, that oral tablet or lozenges we are taking, we can remove it from the mouth and keep it outside if you are having uncomfortability, right? So, in case of this overdose, we cannot revert it back. Prevent scarring and other skin changes and can influence the drug absorption. Drug absorption can also be influenced by the parenteral routes. Moving on, let's learn about general requirement of parenteral product. What are the general requirements? What are the things that we need to make sure when we are making a parenteral product? Okay, number one is stability. Stability of a product need to be very much sure. Why? Because either it can be suspension, emulsion, or it can be a solution. Okay, in case of emulsion, there is a chance that there can be phase difference, like oil and water phase can be differentiated. For that, stability plays a major role. Okay. Second point is sterility. Sterility means we have to just make sure that it should be pyrogen free, it should be free from any kind of foreign particles, microorganism, so that if that parenteral product is intended inside the body, it should not hinder our health, because if a microbe is there in our parenteral preparation, it can cause microbial infection in our body. This is what we don't want. Okay. So, that is why it is sterility testing should be done. Third point is, it is free from pyrogen. What are pyrogen? Pyrogen are those ailments, those foreign bodies that if entered inside the body increases the temperature and it causes fever. Okay? So, that is why we need to remove it. If our formulation have pyrogens inside it, obviously it can cause high temperature inside our body. Free from foreign particles. Obviously, we should take care that our product should be free from foreign particles, because it is directly entering inside the bloodstream. So, it need to be very much taken care that foreign particles should be easily removed. Isotonicity. What is isotonicity? This is an important point. Isotonicity of the parenteral product should be same as what our RBCs is, what our bloodstream is. 0.9% of NaCl is considered. Why? Isotonicity means we have to maintain the particular tonicity of the particular environment. We are going to elaborate it later on, just for some reason. Okay. Chemical purity. Chemical purity of the product need to be taken care. Properties of parenteral products. Moving on to the properties, when we are making a parenteral products, what are the things we need to take care of? Number one, sterile and pyrogen free. As I told you, it should be sterile, it should be pyrogen free. For both of them, we are having different tests, sterility test and pyrogen test. For pyrogen test, we have LAL test that we are going to read further, and for sterility test, we have lots of tests that we are also going to read further. Clear and sterile solution should be there, it should be clear and sterile solution. No phase separation is the third point. Phase separation, as I told you, emulsion, in case of emulsion preparation, there is a chance that oil phase and water phase are differentiated. Okay? So, that need to be take care when we are making the parenteral products, that our phase should not be separated, because if oil phase and water phase should be separated, oil phase and water phase should be separated out, there is no point, because there will be no stability. So, this point should be taken care. Okay? Biocompatible excipients. Excipients that we are going to add. Excipients are those agents that are being intended in the formulation and that has no use for our therapeutic action. Okay? Apart from API, the things we are adding are excipients. It should be biocompatible, means it should be biologically compatible to our body. Isotonic. Okay? As I told you, isotonicity, we will elaborate it in further slides. pH of the isotonicity should be 7.2 to 7.4, means our parenteral product should have a pH of around 7.2 to 7.4 because of the blood as having same pH. Increasing solubility, obviously the solubility of the product should be better. Antimicrobial action should be there. Last point is antimicrobial, means antimicrobial action should be there, because if there is any kind of a microorganism that is being incorporated inside by mistake, it can be used for fighting that organ. Moving on, type of parenteral product. Parenteral products has various types, so we are going to divide it on the basis of different classes. Number one is on the basis of types of packaging. On the basis of types of packaging means how they are getting packed. Two type of we can differentiate. Number one is single dose units and number two is multiple dose units. What are single dose? Single dose are that can be used for at one time, like ampoules, infusions, pre-filled disposable syringes. They can be used for one time, one at a time. Okay. Multiple dosage means you can use multiple dose of vials. Like for an example, they can be reused again and again. Okay. This is why they are getting divided on the basis of their packaging. On the basis of production and control, how they are getting production and control. Okay. Number one is small volume parenteral, that is volume less than 100 ml comes under small volume parenteral. Okay. Large volume parenteral is another classification that comes under on the basis of production and control. Okay. Now we have volume more than 100 ml. So if you have a parenteral product that has a volume less than 100 ml, it is considered as small volume parenteral. Whereas when you have a parenteral product that has more than 100 ml, it is considered as large volume parenteral product. On the basis of physical state of product, as I told you, on the basis of physical state of product, these products can be divided into sterile suspension, sterile emulsion, sterile solution, sterile solid, all these things that are going to incorporate. Okay. On the basis of administration, on the basis of route of administration, these are being divided into various categories. So number one is intravenous, IV you can say. Have you heard about, lots and lots of people have heard about IV. What is IV basically? If we break the word intravenous, intra means inside and venous means veins. So it can be learned the injection of drug directly into the patient's veins. This is called as intravenous. After that, intramuscular, drugs is injected deeply into the muscles. Okay, this is called as intramuscular. Muscular, from muscular you can learn muscles. Okay, from venous you can learn veins. Subcutaneous, drug is injected under the skin, fatty layer. When you are in a fatty layer, like when you are incorporating your drug inside the fatty layers, these comes under category of subcutaneous. Okay. Next is intradermal. Intradermal means, dermal means skin. Inside the layers of skin, few layers of skin is called as intradermal. Moving on, intracardiac. From the cardiac name suggests, it means related to heart. So drugs is injected into the cardiac muscles in case of emergency. Like there is a lots of emergencies, strokes, heart attack, we can go through intracardiac. Intracerebral, drugs is injected directly into the cerebellum. Okay. Moving on, we have pre-formulation of parenteral preparation. Parenteral products pre-formulation. Okay. So first of all, what is a pre-formulation study? Why is in need of pre-formulation studies? Pre-formulation studies are the studies that need to be basically pre-formulation or the testing is the first step in which the rational development of dosage form takes place. When we are making any kind of a drug, any kind of a formulation, we have to go through these pre-formulation studies. Why? Because if we are not going through these pre-formulation studies, what are the different factors, bulk characterization, crystallinity, molecular weight, all these things that we have to, solubility, we have to just make sure before formulating a particular drug, these things need to be keep in mind. Why? Because it is mainly used to develop the efficient dosage form. What is the solubility of a drug, how a drug is acting, what is the bulk characterization, what is the crystallinity, amorphous, is it amorphous or it is crystalline, all these things comes under pre-formulation studies. Okay, it gives information for the designing of dosage form. Obviously, it is used to identify molecular structure, formula and molecular weight. Okay, this is what your particular pre-formulation study is. What are the different factors? Moving on inside here, there are lots and lots of factors you can see listed over here. Number one, we have bulk characterization. Okay, let me enlist it. Bulk characterization, which comes under crystallity, polymorphism, particle size, powder flow property, surface characterization, and moving on, solubility analysis, drug pKa, ionization, partition coefficient, thermal or heat efficiency, and solution stability. All these things we are going to learn one by one. Okay, Moving on, bulk characterization. In bulk characterization, we have crystallity, that is the first point. Crystallity means when we have crystals. We are talking about crystals over here. Crystals can be of two types. It can be crystalline, obviously the arrangement of a crystal can be on crystalline, or it can be amorphous. If your particular drug is crystalline or amorphous, we have to just identify it. How we are going to identify? By the means of different structure. Okay. So, what is crystallity is? Crystallity is basically the internal structure of drug that can affect the bulk and physico-chemical property which range from flowability of chemical stability. Okay, means what kind of arrangement your drug is having, that arrangement is being decided by the crystallity, whether they are arranged in a very regular manner. Okay, like for an example, I am drawing a diagram over here. You can see it's a very regular diagram. Okay, it's very symmetrical, or you can say a regular diagram over here. Okay, why I draw this? Because of the internal structure of a drug can affect whether about this particular profile. This is called as crystalline. Okay, and what is amorphous? Amorphous means irregular structure, like this is very irregular arrangement. This is called as amorphous. Okay. The crystal habitat describe the outer appearance of crystal. These are the crystal habitat, these describe the outer appearance of the particular crystals only. Okay. So, in this diagram you can see we have polymer crystallity. Okay. In this diagram you can see this is the crystalline region and this is amorphous region. Crystalline region is somewhat symmetrical. You can see we have a bold line, black color lines over here, these black color lines. These are regularly arranged. Okay, we have a regular arrangement, whereas the thread like structure you can see over here, these arrangement thread like structure, this is a very irregular arrangement. This is called as amorphous region. Okay, so based upon our drug is getting categorized in amorphous or crystalline. Okay, this is what your particular crystallinity depends. Okay. So, if how it is being used in case of drug, if you have amorphous or if you have irregular arrangement of the molecules, it can break down very easily. If we are giving any shear stress or we are giving any energy from outside, it can be break very easily. Whereas in case of crystalline, they are intact very properly, so they cannot be break very easily. The bonds cannot be break very easily. Next is polymorphism. This is also a part of bulk characterization. What is polymorphism? Polymorphism means we have a crystal lattice, right? That crystal lattice, what is the meaning of crystal lattice here? I have a arrangement, okay? One crystal is there, one type of a crystal is there. Polymorphism, poly means more than one kind of a crystal. What it says? Polymorphism is the ability of a compound to crystallize as more than one distinct crystalline species with different internal structure. Like we have a lot of internal structure, they are getting arranged in different manners. Okay, so polymorphism is basically that ability when we are getting arranged different crystalline particles inside it. Okay, formation of different polymorphs depend upon solvent's temperature, pressure, rate of cooling, how the pressure is getting exerted. Okay, next is particle size. Particle size plays a very major role. How? When you have less particle size, obviously every formulation we have, study of particle size gives an information about the solubility, dissolution, absorption. It should be noted that when you have a small particle size, surface area increases. Okay, when surface area is increasing, obviously absorption is increasing. Okay, this is what we are going to do when we have a very small particle size. हमारा particle size अगर कम हुआ तो दैट्स ऑब्वियस आपका सरफेस एरिया इंक्रीज हो रहा है. अगर इंक्रीज हो रहा है तो आपका जो एब्जॉर्प्शन है वो भी इंक्रीज होगा, आपकी बायो अवेलेबिलिटी इंक्रीज होगी, सॉल्युबिलिटी इंक्रीज होगी, डिसोल्यूशन रेट इंक्रीज होगा. सो दैट्स व्हाई इट प्लेज अ वेरी मेजर रोल. ओके, द पार्टिकल्स ऑफ कैरेक्टराइजेशन plays a very important property, and here smallest particles should be tested to facilitate homogeneous sample preparation. Okay, for a homogeneous sample preparation means for a simple and safe, or you can say homogeneous means sample is particularly simple or safe, like they are same all over. For the homogeneous preparation, you have seen when you are formulating a tablet, you can see that what do, we just pass it through different sieve. Why we are passing it through the C? Because we want same particle and in a very small particle size. This is what dealing with particle size. Particle size plays a very major role. When we have a small particle size, it increases surface area. When it is having an increased surface area, it increases the absorption rate. Next is solubility analysis. Solubility analysis, you can see aqueous solubility, drug pKa, partition coefficient, thermal effect and aqueous solubility. We are going to learn all of it right now. Okay. Number 1, moving on, drug pKa, ionization of a physiological pH. Okay. pKa is called as dissociation constant. Okay. pKa is called as dissociation constant. Okay. A drug, like for example, you can learn it by this. There is a reaction. This is a weak acid. Okay. Acetic acid. This is a weak acid. It is being dissociated. It is dissociated into CH6O negative H minus. Okay. So this can be dissociated very easily. Okay, this is a weak acid. So what we are going to learn, what is dissociation constant? A drug, when it is being dissociated, it can be dissociated into two forms, ionized and unionized forms. Okay, ionized and unionized form, non-ionized or unionized form. The unionized form have a better absorption. Okay, why? Because they are not getting ionized, they can be passed through a lipid layer very easily. Okay, that's why the non-ionized substance is lipid soluble. As I told you, it can be passed on from the lipid membrane very easily. Thus they are going to dissolve in the lipid material of the membrane and transported by passive diffusion. Okay, so basically our drug need to be undissociated or non-ionized. It is non-ionized, and if it is non-ionized, it is getting passed through lipid membrane very easily. Next is we have partition coefficient. What is a partition coefficient? Partition coefficient influences the permeation of a drug across biological membrane. In a biological membrane, we have lipid moiety over there. Partition coefficient is the ratio of equilibrium concentration of drug in oil phase to the equilibrium concentration of a drug in aqueous phase. Means we have a ratio of oil and water. Okay, we have to just make sure these oil and water ratio need to be maintained. This is called as partition coefficient. While we are doing the parenteral product preparation, we need to make sure that partition coefficient, drug pK, ionization, all these factors need to be taken care. Another is we have heat effects. Drugs which are unstable to the heat requires refrigerated storage. There are lots of drugs that require storage, a proper storage. Why? Because if we are having refrigerated storage or lyophilization, we can go through by lyophilization. Why? Because there are lots of drug products that are thermolabile, that are susceptible to heat. When they are getting exposure to heat, they are getting damaged. So for them, we need to make sure that drugs need to be properly stable. If the drug is unstable to heat, we should be kept in a lyophilization manner. We should be keep the product in such a way that they can be used for a long period of a time. Another is solution stability. Solution stability plays a major role, as I told you in the first slide. Okay. The primary objective of this phase is pre-formulation research is identification of conditions necessary to form a stable solution. As we are working on the parenteral products, that parenteral products need to be incorporated inside the veins. Okay, so they need to have a solution stability, means the solution that we are using should have proper stability. Okay. Next is dissociation constant. Dissociation constant. What is dissociation constant? Is a commonly used to describe the affinity between the ligand and the protein. Okay. In our blood, there are lots and lots of protein segments in there. So protein binding we are going to learn later on. Okay. So the drug, when it is binding to the particular protein site, at how much boundations they are having, how much affinity they are having, that depends upon the dissociation constant. Okay. The dissociation constant is commonly used to describe the affinity. Affinity means how strong their bond is. Basically, the drug and the protein, how tightly they are bound to each other. Okay, this is called as dissociation constant. Another is compatibility studies. Compatibility means when we are having compatible, like when you are getting married or what, then obviously you have to see the compatibility of two people that are getting married. Okay, so the drug excipient compatibility plays a major role. When your drug and the excipients, means the additives you are adding, they are not compatible with each other, obviously they will be unstable. Okay, this is what simply you can learn by compatibility studies. The drug excipient compatibility studies are carried out and intend to identify, quantify and predict potential interaction along with the impact of these interaction of drug. Okay. So let's revise what we have learned in this class. We learned what is parenteral product. Parenteral product are basically the sterile preparation I told you that is being intended to be used inside the systemic circulation and has a therapeutic effect. Okay. What is the advantage we have covered in this lecture? What is the disadvantage? What are the types? Types I told you lots of types and they are based upon their packaging, their production, small volume parenterals, large volume parenterals, all these things, the types based upon how they are getting administered inside the body, intrasubcutaneous, intravenous, intracardiac, all these things that we intradermal, all these things, intracerebrum, these are getting listed in types. Okay. Moving on, we have a pre-formulation studies. Pre-formulation studies plays a major role. Okay. So, when you are completing this topic, when you are learning this topic, you should have some proper basics to be clear. This is a very basic intro of this particular unit that we covered introduction in the advantage and disadvantage, because we should know what is the advantage and basic disadvantage. Okay. Pre-formulation studies is basically we have bulk characterization, solubility, all these things that we have just discussed and many more things. Okay. So, I hope you understand all these things in this particular occasion. Okay. So, this is basic need of how we are going to just understand each and everything related to parenteral products. I hope you understand this lecture. If you have any problem, just do let me know. So, yeah, this is what all about the parenteral products. So, thank you so much for watching this video. Thank you so much for listening this lecture. Next lecture will be on formulation of parenterals, vehicles, additives and importance of isotonicity. Okay. Thank you so much.